You're listening to Unleash Home Care, brought to you by SwiftShift, where we discuss the latest in home care.
Hi, Betsy. I'm Assaf, Shalvi.
Betsy Walker.
And we're going to talk a little bit about the experience of Betsy at Golden Care, working in the self-managed team method, and just home care in general. So, Betsy, do you want to just introduce yourself in a few words? Like, how did you get to home care? Why did you get into home care?
So I've been doing home care for probably over 10 years now. I worked at the hospital in Philadelphia and just got tired of the hustle and bustle, and you have 10 patients that you're responsible for, and you just feel like at the end of the day, you couldn't do everything that you needed to do for your client because you just did not have enough time. One person can only do so much. So I actually had a friend that was a nurse that was like, maybe you should try home care. And she talked me into talking to another company that was doing pediatric, and I loved it. Like, it's not just about caring for that client, it's the connection with the client's family. You know, you become part of their family. You're spending so much time in their home with their child. You know, these parents are putting their kid's life in your hands. You know, you're responsible. And I just fell in love with home care, and I've been doing that since.
And you weren't worried to work by yourself without, the doctors and the supervision and all the other stuff you get in a hospital?
No, because, I thought about that. I was like, well, okay, what's going to happen if this happens? And with other companies, it was, oh, we'll get back to you on that. But with Golden Care, love it. I mean, if I have a question about something, I'm on the phone or I'm sending a chat and I've got an answer. It's not, let me give you 2 days and I'll get back to you about how we could solve that. So no. And I think having the experience working in the hospital gave me enough confidence to work at home, you know. And this Golden Care, we were just talking about this the other day during our team meeting. I don't feel like we have such a connection with the team, and we have our team meetings. And anytime something comes up that, you know, somebody on the team is like, okay, we got to let everybody know this. We have so much communication. I don't feel like we're in the home alone. It doesn't feel that way because there's always somebody, you know, you reach out because you have a question or somebody's reaching out to you. Hey, how's it going? We just recently added 2 new cases to our team, you know, and as a CCL, you reach out. You know, after the first day, hey, how's it going? Any questions? Do you need help with anything? And I think that the nurses really appreciate that. You know, they're not just stuck out there and they're on their own to do whatever, figure it out. There's people saying, how'd it go with the charting? How'd it go with the client? Is there anything that you need? And we do that for the first week or 2. And then they know, okay, I'm just going to reach out to the CCL if I have this issue or that issue. So
okay, so you jumped us forward. You mentioned Golden Care and everything else. So if you want to maybe explain a little bit, when did you join Golden Care and why did you join and what happened since and what have you done before, just to give everybody a context?
Okay, so I've been with Golden Care for almost 2 years now. Doesn't seem like it's been that long, but it has. And Tracy, who was one of our recruiters, reached out to me. She saw my resume online and was like, hey, you know, we're this new home care pediatric agency, and we're offering CCL opportunities to everybody on the team. It doesn't matter if you're a CNA, a home health aide, a LPN, and that is kind of what got me, I think, because I was like, okay, well then that's something a little bit different than just doing home care with your patient. That's an opportunity that other companies don't offer.
So what's CCL?
So CCL stands for Client Caregiver Liaison. So pretty much you're that person that the patient's family is going to reach out to if they've got issues, they've got questions, concerns. And then you're also the person that the caregiver is going to go to with any issues. So it's a really good opportunity. And you can learn I've learned so much with this company that I never had the opportunity to do with other companies. You know, I've learned about case management. I've learned about scheduling. I've learned about just the documents that you need to open a case, to start a case, what the school needs. Like, I never had any any experience with any of that before. But the CCL, Client Caregiver Liaison, is a really good program that I think everybody should take advantage of. There's a weekly bonus. I explained at a team meeting just a couple weeks ago that, just like any job, you got 30 days in the month. There might be 28 days where it's smooth sailing and then 2 days where you're like, what is going on? Same thing can happen in home care. Yeah. But the 28 days of smooth sailing, that's a really nice bonus to get, right? I just think anybody in the company should take advantage of that.
You joined 2 years ago. You were the first person in this area, or was there already something here?
No, there was nothing here. And actually for the first probably almost full year, I worked on a case that was down near Scranton, near Clark Summit. So I would drive down 5 days a week. And then the gas prices kept going up and up and up. But I'll be honest, I was like, okay, well, they're letting me do this and this and this. And the other companies up here, Bayard and AVI, they're not going to let me do that. It was worth it and I had a really good client, and I worked Monday through Friday. How sweet is that? No weekends, no holidays, right? So there was a lot but then when the gas prices started going up to $5 a gallon, I was like, I got to do something closer to home. And that's the other thing, I explained to our nurse success manager, like, this is getting too much. I need to find a case at home. We found a case at home, and I was only working 4 days a week.
So how did you find this case?
Through a friend had mentioned, like, hey, this case is coming open. You might want to go check it out. So that's how I found that case. So then it was, hey, do you want to work on opening Bradford County and Sullivan County? And I was like, when do you want me to do that? I was working 48 hours a week with this case. And it would have just been too much at that time, I think, for me to take on. But then another opportunity came up where I was only going to be working 3 days a week on a case. And that opened a lot more possibility for me to start a team, grow a team, to have the time to do it. And that's what I did.
So tell us about the current team. How many people are on the team? Who are the clients? How do you manage this team? What's important to the team? How did the team evolve over the last when was that? When did you leave the Scranton case and start and move to the 3-day job? How long ago?
I started. We officially had the Bradford team in June of 2022. And as of right now, we have, so it was just me and one client. And as of today, we have 14 clients and 15 caregivers. So in like 8 months.
8 months.
Yeah. A lot of it was just put your face out there, introduce yourself to the local school districts, special education departments, the principals, call the pediatrician's office. Like, hey, this is what we're doing. We're the new kids in town. This is what our company is about. We want happy clients, happy caregivers. This is what we're doing. This is how we're doing it. I think the module that I want to say that this is what we're based off of is team nursing. And a lot of people think, hospitals do team nursing. It's a CNA, an LPN, and an RN with a client. That's not the same here. So we're self-managed, meaning there's no hierarchy role. Everybody is the same. When you're working in the hospital, they say team nursing. Okay, it's the CNA, the LPN, and the RN. Well, it feels like they look down on the LPN and the CNA, even though they're probably doing the hardest part of the work, the physical part. It's not like that here at all. Everybody is the same. It doesn't matter if you're a home health aide, LPN, CNA, or an RN. You're all the same.
So what do you have? How many RNs? How many LPNs? How many CNAs? Do you know, top of your head?
So we have 15 on our team. Out of the 15 right now, we have 2 home health aides and 1 CNA. And the rest are all LPNs.
And how many RNs that support?
So right now we have 4 RNs.
So that's on top of the 15?
Yep.
So 19 including the RNs.
Yeah. And even that has grown because when we started, there was no RNs.
Yeah.
We had Kim doing everything from Wilkesboro. And then we brought on Michelle, and now we have 3 other ones. So, yeah.
Okay, so we're saying you manage it yourself. There's no hierarchy.
Nope.
What else do you think is working? Why are people joining? What creates this momentum? And what did you learn in that process?
Definitely.
Have you changed stuff?
Definitely the benefit package is a huge seller. The starting pay is a huge seller. A lot of the people that were reaching out to me that were saying, they're working for this big company over here, and you're paying $5 more an hour to start to do the same job I'm doing? Yes. So definitely starting pay. Benefits. I have never worked for a company where you get every January 40 hours of sick pay. It's always you're going to get 2 weeks or 3 weeks PTO. Have at it, use it for your sick time, whatever. We don't care how you use it. But that's 40 hours a week sick time is huge. I think that's a big seller, on top of your PTO. A lot of these other companies, you have to work with them for so long before you can use your sick time or PTO. It doesn't make sense to me, but that's what I'm told, that bad staff were blown away that they could use it as soon as they earned it because they had to wait 1,200 hours or something crazy before they could use it. So that's a big selling point. We have really good medical insurance.
Chosen by the teams, by the way.
Teams, yeah. Because actually when I started, I think I was number 3 hire, either 3 or 4. So when I started, SwiftShift personnel were like, okay, tell us what you want. What kind of benefits do you want? So we created this committee, which is kind of funny because there's only like 5 employees, but we had 5 people on the committee. And we were like, all right, if we want to attract people, we want to be able to have good health insurance. We want vision. We want dental. We want short-term and long-term disability. We want, life insurance. We want a 401k. Sick time. And, we got it. And not only did we get it, but the company was paying for everything except for the medical part. And they pay a big portion of that. So I wasn't expecting that when we found out, okay, Golden Care is going to have all this. Fabulous, right? But then when they said the company is paying for it, that's huge. A lot of people are like, oh, well, that only costs $1.56 a week or $3. It's money that's staying in my pocket and I'm not going to have to pay for it. So I appreciate that. That's a benefit. It's a good benefit.
So you are now with the team for 8 months. Did you change? Did anything change in the way that the team operates? Did you change the procedures? How the relationships with the RNs? Did you have any learnings from working like that over the last 8 months?
Yeah. I mean, we had to do some tweaking along the way, which is another thing. There's not like, this policy, you got to follow it till we all are dead.
Maybe you can explain, because I'm not sure that people know how does it about the service planning and how do you manage it, or how often does the team meet? How do you make decisions? How do you manage the clients? How do you decide who to hire, who to not hire? Right. Can you tell us a little bit about that?
So we do what is called the team service plan, and every team has their own. You create it, essentially. So the team gets together, we have a meeting, and we say, okay, this is what they're asking us. What are our thoughts? And we write it up, and then we have a meeting. We do a meeting once a month. We do a meeting once a month just to fill people in on, this person wants to come work for us. What do you think? We vote on everything. It is a, vote and it's unanimous decision. That's how we vote. This client wants to come. What are your thoughts on this? Because this has been an issue with this one or that one. We want to talk about it. We don't want to take on, I don't want to say we want to turn clients away, but we like the ability of, if we know it's a difficult case, to keep somebody staffed, keep somebody, do we really want to take that on? That is the thing.
Don't want to create expectations that you can't fulfill.
Right. And if this one and this one and this one can't do that, well, what makes us think we're going to? We like to talk it out. Everything is discussed. We vote on it. That's the way it is. Same thing with caregivers, we want the best in the business, right? So we don't want somebody that calls out sick all the time every Friday because it's payday. We want somebody that's going to show up for the client. I've worked with people like that. It really does happen.
We all do.
So we put a list out. Okay, these are the people that have contacted me. what are you guys' thoughts? Does anybody know this person? You know, we've done an interview. They answered the questions really good, but does anybody really know this person?
Yeah, right, because your team has been around here working in home care and other facilities for years. So if you don't know somebody, that already tells you something. Or if you know them, you probably...
Or somebody's sister's cousin knows somebody, you know. It's a small
It's a small place. Yeah.
Yes. So yeah, we do the monthly meeting. We do quarterly. We update our service plan, and of course, like if we have a new hire, we'll update it by just adding that person. They have to sign it. Everybody in the team has to sign it, saying they agree, and it's basically our policies that we create, meaning our little team in Bradford and Sullivan County, not people in Hershey or Williamsport. Because this is, you know, everything is different depending on where you live. It might not be the same. But it's not like, oh, well, this is going to be this way forever. If we create, or say a policy, we put it on our service plan, and it's not working, we can change it, and we do. We all have to vote on it and re-sign it, but it's that option of being able to change it that's wonderful.
So that brings me to another kind of feedback that I always used to get when I was talking to people that run large home care businesses and talk to them about this model. They said, oh, you know, the caregiver, they won't be able to do this and this and this and that and that and the other, and it's not going to work because of the persona of the caregivers and whatnot. So what has been your experience with it? Maybe you want to share what have you first of all done so far other than direct care with your team, and what do you see and how do you relate to it? Is it true that, okay, yes, you know, most people don't want to do it, but some people want to do it, or does everybody have to want to do it? Like, how do you deal with this probably somewhat valid, you know, concern?
Right. Well, so we have it right in our service plan. If you don't want to do the extra stuff, you don't want to do the interviews, you don't want to do CCA, that's fine. Because first of all, do you want somebody thinking they have to do it? Are they going to do a good job if they have to do it and they don't want to do it? No,
yeah,
probably not, right? And then you have some people that are working 50 hours a week. They don't have time to do it. And honestly, I understand that. So you want to be able to have the people that want to do it. And if they don't, give them the choice. So far, it's been working. And honestly, I have people that are CCLing now that were like, nope, I don't want to do that. But then after I was like, wait a minute, let me tell you about this. Now, I have two that have gone through the mentor program that have graduated that are so happy they did it, because they're like, the one girl was like, this pays for half of my rent for the month, just the bonus.
Yeah.
Not counting the hours that she can bill, the time she can bill for other things. I was like, I told you. So yeah, those two they're like ready for more. Like, can we do another one? So we're going to work on that. I have two more people that are fairly new with the company that are like, we want to do this now, because the other two did it and then they found out, oh, they were so happy they did it. So I do think nobody should be told that they have to do it, because they might not do a good job for you. And I do think that the more people understand what CCL is and what your responsibilities are and those very nice bonuses, that more people will want to do it. They would be crazy not to. But as far as, I work a case 3 days a week. I do CCL. I do recruiting. I do referrals. I do a little bit of everything. But the
IT support, you do,
yes,
you do some of that too, no? I can see you sometimes, restart your iPad and...
Yeah, I just do whatever. We just do, but that's how we're working it up here. And that's what I think is making us grow so big and be so successful, because everybody's happy on our team, right? Have you ever had a job where you're just like, it's Monday and I got to go to work? I don't feel like that.
Not for a long time,
right?
But yeah, I did 12 years ago.
Yeah, and I think even like you think about our town hall meetings, when some of these people first join, like not very many people, now lots of people get on the town hall, right? Because more people are motivated in the company. I think more people are understanding what you're trying to create here with Golden Care. And I feel that way about our team too. So do I wear many hats? Yeah, but when it gets to be too much for me, then that person or that person or that person steps in. That's how we do it.
So thank you for sharing with that, and sort of looking into the future, right, of the team and the team model. Where do you see this could go? Where do you see this could go? And and specifically where can this maybe fill a gap that is currently not filled by the traditional home care companies or other health services?
I think
Sorry to put you on the spot, but
No,
if you want to
but-
think about it
yeah.
for a bit, feel
Right.
free. But we didn't practice this. This is all spontaneous.
Yeah.
So.
All right. So let me give you a perfect example. Our team size, they want them to be no more than 12, right? Because it does get to be a lot to manage with 12. That you get really busy. So we're getting ready to split. Do I see adding and splitting? Well, I added somebody last week, and I'm adding somebody hopefully next week. So the calls keep coming. Do I think it's going to keep happening? Yeah, because there are a lot of families. I told you we have a new case that's opening hopefully by next week. That mom has been waiting. It is February 2023, okay? She's been waiting since October 2021 for a nurse for her baby, right? So the need is out there. And that's not the only mom. And that just happened to be, somebody saw a post I put on Facebook and was like, hey, I need a nurse. Can you find me a nurse? They're out there. I spoke to one of the nurses at the local pediatrician office, and I told her a little bit about Golden Care, what we're all about, She was like, thank God. We need more people like you.
But would she do home care, right? Because the problem is that more people need to want to work in home care, right? Otherwise it's the same people moving between different agencies. But if you really want to solve the problem, how do we, like in your team, is there anybody that you brought in from outside of home care?
Yes.
And what made them
Yes.
Do you see that this approach is selling better to people that are maybe wouldn't go for a traditional agency? I'm not.
Right.
You can be honest about it.
No.
You say no if you think it's not.
No. So we just had a recent hire who actually got my phone number from the client that I take care of currently. His mother. They stayed friends. I told you, like a lot of things with these home care jobs, you stay friends with the family even when you're not caring for their child. You become a part of their child's life, their family. But anyways, I went to work, and the mom at that case was like, hey, I know this nurse. She used to actually work for me here. She is amazing. She wants a new job. And I told her to get in touch with you because this Golden Care sounds wonderful. We just hired her. She worked at Hershey Medical Center.
And what's her first impressions moving to home care?
She's very happy. She's very happy. And she was on a case that was a little more challenging than what she was prepared for. But she is the one that we're moving to a new case next
She
week.
had to probably take a salary
Yes.
cut, no?
No, she's
No?
making the same.
Yeah, the same.
She's going to do the
Because
same.
mostly facilities, I think, pay a little bit more than home care, no?
I'm sorry. She is making more money per hour with us.
Really?
Yes.
Okay.
Yes.
Because of all the bonuses and the opportunity to do
Yes.
more than just billables.
She was very happy with her first paycheck.
So, and how can we get more of these kind of, fresh pool of
I think
candidates,
that,
that don't know, maybe don't even consider it because it's not very accessible, right?
no, and a lot of things that we were just talking about.
To do the
this,
training,
how-
and you need to go through so many credentialing. It's not an easy process to get into home care. They make sure it's a lengthy process. But I guess how do you make it attractive, or how can you grow your team with people outside of home care?
I think the fact that I wish you would talk to other people on my team. You really should.
No, so next time. So
Yes.
next
Yes.
podcast will be with a team.
Because when you have happy workers, right? And I will say, like, you met Sheila today.
Yeah.
You met Marge today.
Yeah,
very
I met two of
happy,
your
right?
teammates.
So you met two. But they really truly are happy with the company, with their job. So that's where I think word of mouth, like, oh man, you need to work for this. I mean, I do it all the time. I say I sound like a used car. So I'm like, I know this doesn't sound true, but it really is true. Like, never been given the opportunity to do the stuff that I am with this company. And I love it. When you can call a mom and say, I found you a nurse. And she's like, oh my God, I've been waiting since October of 2021. Are you kidding me? That's a good feeling.
It's a good feeling. Yeah, it's a good feeling, especially for these kids.
So I think a lot of it is going to be word of mouth, get the word out there,
Okay, that's what we're trying to do with this thing.
Yeah.
Okay. Anything else you want to add, or any questions you have to me? We'll flip the roles now.
Ooh, let
You
me
can
see.
be the.
I don't know, because I can honestly say every time I've brought something to you, like you've taken care of it, like you honestly have, or you've said, Betsy,
I'm sure I dropped the ball on so many things, but you're very kind. Thank you.
But if I say this is the problem,
including
and this
the request to bank the bonuses, which I didn't forget, we're working on it. Chris is on it, but that's a good example. I think you want to share what that is about. I think that's
so we do a weekly team
bonus incentive,
right? Incentive. We have so many hours that we need to make it at. And we have some staff who are just school case only. So if it snows, and it snows a lot here, it's icy, school's closed, they're canceled, they have no income that day. So instead of doing, the incentive bonus each week in our paycheck, we're like, hey, let's just do the equivalent in comp time so that we can bank that. Kind of like a savings account, right?
Yeah.
And we can use that if we're called off, if we're canceled. And
then you asked me about it, and
he was like, sounds like a great idea. Let's check it out.
Let's see if we can do it.
Yeah, and we're doing it. So, and everybody's happy. And then, most of the stuff that I bring you to, you'll say, okay, what's the problem? What's your solution? Let's see if we can fix this. And we do, right? I don't think there's anything that I brought to you. You were like, absolutely not.
No, not that I remember.
No.
But usually, because the solutions from the field, they usually make sense.
Yeah.
And the problems, are real. So.
Yeah. And Omar is wonderful about, I send her a message like, hey, I forgot to do this. Can you do that? And 2 minutes, I got it, Like everybody helps everybody out. It's really nice. Even the IT guys. I feel like I should have them over for a picnic.
So you're easy on me. Really no tough questions.
Right?
I appreciate it. But you can if you want.
Seriously. Like it is. I had said that. I think I said that in a message to one of those guys, or maybe one of your questionnaires, your surveys that you send out. Because I've worked for companies where you're like, hey, I'm having a problem charting this. And they're like, yeah, we'll work on it. And then 3 months later, you're like, did anybody ever do anything about that? Oh, I forgot about that. Where these guys are like,
Yeah, the big difference is that we don't use any software that we don't build. So we build our own software. So all the other companies in home care, I don't know even one company that uses its own EMR, its own electronic medical record system. They use and if they did build it, it's basically like something very old and very complicated. And also, I think, like you said, the caregivers are not the main users of these systems. Usually, these systems are built for audit, finance. Mm-hmm. Then eventually there's somewhere down the line there's a nurse, and because I see you as my client. Okay, I see. When I come to spend the day with you, I'm saying to my team, to myself, I'm going to spend a day with a client, because we are here to service you. I don't deliver home care. If I take a day off, nobody cares, and all the clients, wouldn't even know. But if you take a day off, they will definitely know, right? So I think that's a different in the focus of and the culture. So you have to have the culture of your team focused on, guys, these are the clients, right? And the clients are your clients' clients. Like the families are your caregivers' clients, but you have to support the caregivers. I hope that it was that you're doing a good job in making sure that its culture continues, and if it doesn't, then I'm sure that you'll tell us. So keep us honest. That's the most important thing.
Yes.
Okay. Thank you very much.
You're welcome.
Thanks for listening to Unleash Home Care, brought to you by SwiftShift. Be sure to like and subscribe wherever you get your podcast. See you next time.